Many of us probably know family or friends who have COPD. That's the umbrella term used to describe progressive lung diseases, including emphysema, chronic bronchitis, and asthma. In fact, the Mountain State ranks in the top 5 states with residents who have been diagnosed with this chronic disease. Shortness of breath, a persistent cough, these are just 2 of the primary symptoms usually attributed to long-term exposure to cigarette smoking and workplace environments. COPD tends to be underdiagnosed and can be life-threatening. But thanks to the award-winning COPD treatment program at Camden Clark, those who suffer from the disease are getting the help they need right here.
I was diagnosed probably in 2004, but I was one of these stubborn people that just thought it's not going to happen. And I continued to smoke for probably 8 years longer. And it caught up to me all in one day. I had like a cold, but it felt like my chest was constricted. And I got to the point where I had taken a breathing treatment, and the breathing treatment seemed to make it worse. So I came to the hospital, and I was told that I would probably be put on the vent, and I had nightmares about the ventilator. So I'm like, no, we're not going on the vent today. See, this was on a Thursday night, and Saturday morning I went code blue and ended up in CCU. The ventilator I was on for 2 days before I knew it. And when I came to, I was told by my doctor, he didn't think I was going to come off the vent. And that kind of shocked me.
The most common lung disease here in our area is COPD. And if you think about COPD, it's kind of like if I tell you I have a Ford vehicle, you know what kind of vehicle I drive. But if I say I have an Explorer, you know it's a Ford, and you know what type of Ford it is. That's what COPD is. COPD is a general classification, just like a Ford. COPD is made up of emphysema, asthma, and bronchitis. So if I would tell you those lung diseases, you know exactly what type of COPD that I have.
There is always black and white. Yes, you have, no, you don't have. But there's grays where you're not sure, and that is a lot more of people. In fact, if you even looking at national statistics, 50% of the people are not diagnosed. They just thought of, hey, I've got flu, I got bronchitis. They go periodically and get acute treatments, and they don't sort of. Only a primary care doctor seeing this pattern detects that.
COPD is very important in our area. We have significant percentage of the population is still smoking. There's lots of chemical exposure, which is not helping with the smoking.
That means we are on the highest range. Why? Many factors: smoking, environmental pollution. I see patients from 18 to 100. I see COPD in all age groups.
For years, I've had trouble with breathing. When I worked, they used to have health fairs, and every time they did the pulmonary function part of them, I always did very poorly.
What it does is it basically restricts the airway. It restricts the airway and causes difficulty breathing. There are times primary care we see people coming in with shortness of breath, cough, bronchitis symptoms. If it keeps happening on and off, then you know that they have something else which is triggering, and that's when we do the test to find out. I see probably at least, if you can say new patients or new diagnosis, I might see 1 or 2 per week. That is only me. Just imagine how many other doctors are there, how many they would see. Primary care are the what we call the doorway for them to come in. Patients, if they have it straightforward, it shows on x-ray, or their symptoms are so bad, they're old enough, they've been smokers, it's a no-brainer to make the diagnosis. But the patients who are in between, who come in periodically, who don't have a diagnosis established, who have symptoms of chronic cough, chronic phlegm production, periodic, getting out of breath, unusual, more than usual. In fact, if you really look at it, 50% of the patient have symptoms, they may not have the diagnosis at all. I think that's where the role of primary care comes in, to diagnose them and treat them, because it's more like it's a progressive disease. There's no curative treatment for COPD, but we can always control it, and we can optimize treatments so that their symptoms are limited to the condition, and we can suppress the disease.
Many people mistake their increased shortness of breath and coughing as a normal part of aging. In the early stages of COPD, you may not notice the symptoms. In fact, COPD can develop for years without noticeable shortness of breath. You begin to see the symptoms in the more developed stages of the disease. COPD can also be overlapped with sleep apnea, especially in older patients, which then makes treatment of the combined issues more challenging. Camden Clark Sleep Center and a unique cardiopulmonary stress test provides the technology and expertise for diagnosis if symptoms present themselves. That's why it's important that you talk to your doctor as soon as you notice any of these symptoms.
Usually patients present from their primary care provider because they have shortness of breath, cough, breathing problems. So once they got referred to us, we start asking them questions, and we do a breathing test. And the breathing test will tell us, number one, if they do really have COPD. Number two, how bad is their COPD? It's very important because if COPD could be mild, moderate, severe, and very severe. And the treatment is very different depending on the severity level.
Camden Clark has really tried to change the type of testing that we offer as far as our pulmonary function lab.
Pulmonary function testing is basically a group of diagnostic testing that tells us how well your lungs are functioning. The first one is a spirometry test. You'll get inside the booth here, you'll place your mouth on the mouthpiece, and I'll just tell you to breathe normal, and then I'll have you take a big fast breath in, and then you're going to blow it out hard and fast until I tell you to stop. And then I'll tell you a big fast breath in again. The second test, it measures your lung muscles. The next test we can go into is the Dlco. It's a diffusion capacity test. What that measures is to see how well your lungs are distributing oxygen to your body. Here at Camden Clark, our pulmonary function testing is real critical to your care. If you've already have COPD and you just feel short of breath still, and you just kind of blowing it off for old age and things like that, weight gain, come in and see your doctor and let them prescribe the test for you.
We also have a pulmonary stress machine now, which will help the cardiologist decide, is it a heart or is it a lung issue?
It does complete pulmonary function testing. It does cardiopulmonary stress testing, and it does nutritional testing. So we have one system that can cover the myriad of all different aspects. So we can help the cardiologist out, we can help the pulmonary physicians, the general practitioners, the dietitians. It's got a broad spectrum of uses in the facility.
We do offer outpatient services, so maybe you have a snoring and you have sleep apnea, then you would go through our sleep lab and get tested to see if you need support, BiPAP, CPAP at night.
It is very important for someone to have a good night's sleep, especially with COPD. If they have sleep apnea, that could exacerbate that condition for them. It could cause them to have more shortness of breath and feel more fatigued. A lot of times, if we get a patient in that has COPD and we're able to diagnose that they also have obstructive sleep apnea, and we treat that sleep apnea, that will help them with their breathing and help the condition so they don't have those exacerbations and end up in the hospital or taking a lot of medications and stuff like that. We normalize our sleep just to justify that why we feel tired. We can't do that because that can be an underlying issue going on there. If you're feeling tired throughout the day, if you're feeling that you did not get a restful night's sleep, then there could be something going on like sleep apnea. If your bed partner says, hey, you snore or you stop breathing, those are pretty good signs that somebody may have sleep apnea. To have a sleep study, you do need to see a physician. It can be your primary care physician, it could be a sleep physician, pulmonologist. They will make recommendations on what type of testing they'd like if they feel that you need to have testing.
Camden Clark has really strived to do a continuum of care as far as taking care of our patients with lung disease. We have intensivists that are actually our pulmonologists that take care of the patients once they're admitted with a severe episode of their breathing into the ICU, and they follow them throughout their stay at the hospital. And that goes one step further. Not only are our pulmonologists here 24/7, but they see the patients once they've been discharged. That care continues the whole time.
We have 4 pulmonologists at Camden Clark who are working together to provide the best quality, evidence-based medicine, up-to-date care 24/7. Starting from the outpatient clinic, including the inpatient in ICU, we're available 24/7 to provide the best care. We have a great pulmonary rehab center at Camden Clark where a group of people trained and specialized in breathing problems working with the patient, and we have a very great success with that. Almost every people that went through that process, they tell us that they can breathe better, they can do things better, they can walk farther, and they are able to enjoy quality of life better.
While COPD is not curable, it is treatable. And with proper management, most people with COPD can control symptoms and improve quality of life, as well as reduce the risks of other associated conditions. Camden Clark started a unique program that includes caring for some patients who also suffer from COPD with home visits by a registered nurse. Angela Hupp has been making house calls for about a year now and tells us about the benefits of this unique care approach.
Camden Clark Medical Center started this program approximately a year ago, and we enrolled 10 patients as a trial. It was successful. From there, we built the program as a full-time program with the goal in mind to minimize patients having to go to the hospital for admissions and rather treat them at home.
That's just like a house call, yes. That's when the doctor used to come to the house. I was thinking of that the other day. Well, doctors don't come to the house no more. Right. I got Angela. I don't need to go in.
I get to stay home with my family instead of going to the hospital. Usually I can't sit up good enough for them to check my back, but now I'm set up longer and she can do that and everything. She tells me what's wrong with me and everything. I can keep ahead of it.
I think this has helped my personal health out quite a bit. I mean, just knowing that she's going to come to see me, it's very much up here, you know.
If I had to rate this program, I would rate it an A+. Busy. We have patients enrolled in the program and have had a waiting list multiple times where we've had to let patients know we'll get you in just as soon as we can. Patients have had great results. They're happy with their results. I haven't heard anything negative yet, and I hope I don't.
For others, the respiratory therapy, pulmonary rehabilitation clinic, and the only team of 4 dedicated pulmonologists are what sets Camden Clark apart from other area hospitals in providing the medical and physical treatment of COPD.
If you have COPD, emphysema, or even a restrictive lung disease, you can go through our pulmonary rehab program where we get you exercising and teach you ways that you can help manage your lung disease.
Here at Camden Clark, we have a pretty large and popular pulmonary rehab. We have between 30 and 40 patients per day come through the rehab program. It helps in multiple ways. It helps build their strength so they can get out and do the things that they used to be able to do, like walking their dog or playing with their grandkids. It helps decrease shortness of breath because the stronger their muscles are, the more efficient they are, the less oxygen they require. We also do a lot of education because education is power. The more they know, the better they're able to manage their disease. We educate on medications, nutrition, the anatomy of the lungs, how their lungs work. Everything they need to know to take care of themselves. They spend a couple hours a week with other patients in their class, and they create bonds with other people, and they have friendships, and they give each other information, and they give each other support.
I think rehab is what's kept me alive to make it to transplant. It helped me breathe. It gave me a reason to come out of the house and work on the machines and just be social with people that I normally would just sit in the house and, you know, not do anything, basically.
It's helped me a lot outside working, you know. And before I started this, I couldn't hardly do anything, but now I can work just about anything I want to.
When I found out about this program, I felt that I could benefit from this. Couldn't hurt. I'll do anything I can to make this better, because it is not curable but treatable, and I'll do my part. But I'm thankful that they have this to help people.
This has helped so much. Before, I didn't have the energy to get up and do anything, and now I can do a lot of things. I can't do like I used to do, but it sure has improved to what I was at, and now I can do.
Cannon Clark has won several awards for their pulmonary practice, and awards are nice. We all like to have them, but our focus is really on the individual patient and making sure that we're providing care that they could get anywhere else other than the Mid-Ohio Valley. Making sure that we're testing properly, that we're able to provide the medications that that patient needs and the support that that patient needs.
My life has taken some wrong turns, and they've always landed me at Camden Clark. They've taken care of me, and today I feel like a completely different woman. Being able to get rid of a Trilogy machine, walking without oxygen, I got out of the wheelchair, and I'm physically capable now of doing things that I haven't been able to do for quite a while.